Let's talk about lymphatic ultrasound. It's an absolutely vital tool for lymphedema surgery. But here's the thing. What happens when the best, most expensive equipment just isn't there? Well, today we're digging into a study that tackles that exact problem, and it explores a solution that, honestly, might already be sitting in your clinic.
So picture this. You're getting a patient ready for an LVA, a lymphaticovenous anastomosis. And you've got to map out their lymphatic vessels. Simple enough, right? But the gold standard 18 megahertz probe is nowhere to be found. What do? This isn't a hypothetical. It's a real-world headache for a lot of clinicians. And that headache has a name. We can think of it as the high-frequency barrier. Let's quickly break down why the tools we're told are the best aren't always the ones we can actually get our hands on.
Okay, so here's the trade-off. On one side, you've got the ultra-high frequency probes. We're talking 30 megahertz or more. They give you these incredibly detailed, beautiful images. The problem? They can't see deep at all, less than a centimeter, which is a real issue in thicker tissues. Then you have the current standard, those 18 to 20 megahertz probes. They're a fantastic sweet spot, but the reality is, not every hospital or clinic has one just lying around.
So that all begs the question, is there a more accessible way to do this? And that's really the core of what this study wanted to find out.
And here is that big idea. What if the solution isn't some new, expensive piece of tech? What if the answer is the probe you already use for a bunch of other things? Those common 10 to 12 megahertz probes? Could they actually be good enough for a job this specialized?
So the researchers put them to the test, head-to-head. The plan was simple. First, find a lymphatic vessel with the gold standard 18 megahertz probe. Then, without moving, switch to a lower frequency probe and see if you can find that exact same vessel. So how'd they do?
Well, here's the number you need to see. 86.4%. That's the overall success rate. In other words, more than 8 times out of 10, those standard, lower frequency probes could see the vessel just fine. I mean, that is a shockingly high success rate, and it really suggests this is a totally viable option.
Now, when you break it down by where they were looking, it gets even more interesting. In the lower limbs, where you often have thicker subcutaneous tissue, the success rate was almost 90%. It was a bit lower in the upper limbs, closer to 67%, and that kind of tells us that, yeah, in those more superficial spots, the higher frequency probe probably is still the better tool for the job.
But get this, and this is a really crucial point. It doesn't really matter if you used a 12 megahertz or a 10 megahertz probe. Look at those numbers, 87% versus just under 86%. They're practically identical. This just drives home the idea that even the more common, run-of-the-mill probes are powerful enough to get this done. Okay, the numbers are pretty compelling, I think we can all agree. But what about the visuals? I mean, seeing is believing, right? Let's take a look at what these images actually look like. All right, so over on the left, that's your 18 megahertz probe. See how smooth and sharp everything is? It's a gorgeous image. Now look to the right. That's the 12 megahertz probe. Is it a little less crisp? Yeah, sure. But the important thing, the lymphatic vessel itself is still clearly visible. For making a clinical decision, that's exactly what you need to see. It's totally sufficient. Now, if you thought that was impressive, check this one out. On the left, again, is the 18 megahertz standard. But look at the image on the right. That came from a 10 megahertz portable device. Portable. Of course, there's a little more image noise. It's a bit grainy. But the lymphatic vessel is still right there, plain as day. The fact that a low-cost portable machine can do this, that is a potential game changer.
So let's bring this all together. What does this actually mean for you in your day-to-day practice? What is the clinical bottom line?
So the really good news is this, that standard 10 or 12 megahertz probe you have, it can probably do this work. And what that means is, all of a sudden, lymphatic ultrasound becomes way more accessible, much less expensive, and just a practical reality for so many more clinics, especially in parts of the world with few resources. But we have to be fair and balanced here. The study wasn't perfect. For one, it didn't test if these lower frequency probes could find the vessels from scratch. They always use the high frequency one first. We also don't know if they're good enough for assessing things like vessel degeneration. So the key here is that you still have to think. You have to tailor your probe selection to your patient and what you're trying to accomplish. And that really brings us to the final big picture thought. This isn't just about probe frequencies and image quality, is it? It's about access to care. So the question we're left with is a powerful one. Could a simple shift in the tools we use actually democratize lymphedema imaging and open the door for more patients to get surgeries like LVA. It's a huge idea to think about.